in my seat. Because we're not, we're your constituents. And also, my family's been without health insurance, so I know what that is like. So keep that in mind as I ask my question. With that out of the way, the U.S. national debt currently at over $11 trillion. That's 11 followed by 12 zeros, over $30,000 for every man, woman, and child in the U.S., and growing by around $500 billion a year since 2003. How do you and President Obama propose we pay for this bill, given that according to the Congressional Budget Office, which you just cited and said that you respect, and I quote, enacting H.R. 3200 would result in a net increase in the federal budget deficit of $239 billion over the 2010 to 2019 period. Please, end quote. Please note that this estimate includes whatever savings we might find by cutting costs. And also, if you plan to point out President Obama's suggestion of taking $500 billion from Medicare, please explain how Medicare will still be funded, given that according to the 2005 Medicare Trustees Report estimated that providing promised Medicare benefits over the next 10 years could require over $2.7 trillion in new tax revenues. Again, here's my question stated more simply. How will we pay for this plan without massive tax increases on the middle class, more astronomical borrowing, or both? And if you claim this plan will not raise taxes on the middle class, is that a promise the voters can hold you to? Thank you.
All right. If you're going to continue making speeches before you get to your question, there are going to be a lot of people who won't get their question in, so just keep that in mind as well. Now, as far as the national debt's concerned, you know, this administration, this current administration, been in office, what now, a little over 6 months.
Spending a lot of money.
Spending a lot of money.
They spent a lot of money, but they also encumbered a lot of debt that came out with their occupying the office. You know that too. We're going to have dialogue, so let's just do this. You know, last fall, the Wall Street debacle took place, and the secretary of that administration showed up and said, I got to have $700 billion, and no oversight. Well, we didn't agree to that. After some discussions and so on, why we agreed to try to do something with some oversight and so on. So there's $700 billion. During that same time frame, the Fed, under the last administration, added 800. So that adds up to 1.5 trillion right there. And so by February, the people were saying that this new administration had accumulated all this, and they didn't. They got into the problems at hand, but that came with the going into the office. So just don't, you know, not look at that too.
I agree with you there. I think that was ridiculous.
Anyway, the point that I want to make with you is that a number of us work very hard together to say, if you're going to do something, program or otherwise, you got to pay for it. And we've come up with the term pay-go. So I was with several that met with this new president in February, about 50 of us. We're in the White House, kind of interesting to be there for that occasion. And I was the one that had the last word that evening, and we had a discussion with him. And said, you know, we all believe that you got to pay for what you do. And we realize that there's a national emergency going on now. But we're going to be asking you to accept pay-go rules. And he was very receptive to it. We had a good discussion. We'd already done that with the leadership in the House, and they had accepted it. And so within about 2 months, I don't have the date memorized, but about 2 months I had an occasion to be in a group when the president met with us. He said, I agree, we have got to go to pay-go. So we're going to do that. We got to get to that point. We're going to do that.
How?
Well, we did it back before, 8 years ago. We were into a pay-go situation, and we were actually taking our debt down and operating in surplus. So I think we could do that, but we got to keep it on focus. So thank you for your comments. Alexis.
Here again, sir.
Good afternoon, Congressman. My name is John McCarty, and I'm a member of POWSI from Norwalk. And that stands for Plain Old Work in Iowa. I'm here out of concern for the direction the administration and Congress is taking our republic. I am, for the first time in my life, afraid for the future, and that includes 2 trips to Vietnam for me. I and others like me are tired of liberals and conservatives bashing each other in Washington, D.C. This isn't about parties. This is about the country. We are tired of you and others putting party and Nancy Pelosi's directives above what is good for Iowa. Cap and trade is not good for Iowa citizens, and I think you should have voted against it. The health care bill is not good for Iowa, and you have to choose, sir. Clearly, we would be well served by health care reform in our system, but there are ways to do that that don't take us to socialized medicine into systems that are not serving England and aren't serving Canada and other countries, and I will leave you with some written suggestions that Ahanyak has.
Good, thank you very much, I appreciate that, and I'll be glad to have it. Oh, excuse me, go ahead.
I don't want government intrusion into my life. I don't want my medical conditions public information, and by the way, I haven't seen a doctor in 10 years. I want to help citizens who need a leg up through no fault of their own. I don't want to fund medical services for illegal aliens. I don't want a national health care system where there are those that are exempt from the plan, which includes unions, federal employees, and Congress. That's 25% of the population. That's 80 million people, and you're only trying to provide health care services for 40 million that are uninsured. I want to choose my health care, and I want to pay for it as I can afford to. And I don't want that plan out of business trying to compete with the government. I just want the government to leave me alone. My question of you, sir, is, when you go back to Washington in September, simple yes or no, will you vote for any of the 3 health care plans that are currently before the House?
I can't answer that, but we don't have a bill.
You got 3.
No, we don't, no, we got 3 drafts, and they've got to be melded together, so just, and then when that's done, then you ask me the question, I'll give you your answer.
Will you read it?
Absolutely, I've been working on since the 14th of July.
Why does it have to be a
And so anyway, but first off, just a couple things. Did you say 2 tours of Vietnam?
Yes, sir.
You and me, me too, so maybe we ought to visit sometime. I would enjoy doing that.
Mine were any fun.
We have an employee that's from Bung Tao, and he's a wonderful young man that was put out in one of those boats when he was 10 years old.
Mm-hmm.
I went back to Vietnam last December the first time, so maybe we'll visit sometime.
Okay.
But anyway, on the subject of keeping the government out of our lives and some of the things that you said in your remarks, someone came up to us not too long ago and was pretty upset, like, I understand that. You know,